Everyone, and welcome to our ninth Community Leaders Update on the COVID-19 virus pandemic. I'm Mike Wilder, and I'm the Director of Emergency Management for Danville and Boyle County. We have present today Mayor Mike Perros, Judge Executive Howard Hunt, and our Public Health Director, Brent Blevins. We have a phone number that is listed on the front of this briefing, 859-936-6865 to call with your questions or comments to either Mayor Perros, Judge Hunt, or Brent. Make this statement in the beginning if I can, and we'll get that out of the way. It's kind of been the consensus of opinion of the folks that are involved in this that it's probably time to discontinue doing a weekly briefing. It's more repetitious now, and I know folks are listening to not only the president, they're listening to the governor, and they're listening to us as well. Our group has fallen off considerably as far as viewers go, so we feel like it's probably time that we curtail this and have the opportunity, should we need to get back on for some other reason, we have that capabilities to do it in a very short period of time. So all that being said, this will be our last weekly briefing for right now. In the event that we need to get back on, we can do that. But I know everyone is turning their attention more to trying to get opened up and all of the requirements that it takes to do that. But folks, we have to do that. That's a must. I know it's hard to do, and it's just not a good thing to have to do for a lot of places, but we have to do this. And if we don't do it, we've done so well. And everybody in Boyle County is to be commended for what they've done, the work they've done in doing this, because it's certainly been a team effort to keep where we are now. I'm just gratified. I see it every day. And when I go to Walmart and I go to Lowe's and I see those folks with those masks on, it's pleasing to me to see that. It is, because we're doing the right thing. Other than that, again, all of the different things that have to be done to open your business or whatever we're going to do, the dates we've talked about, they're all online and everybody knows those. I'm not going to go over them again. But again, if there's anything that as far as emergency management can do, please feel free to give me a call at my office and my cell phone either. It's easily assessed. So with that, Mayor, how about you starting us off today?
I will echo your sentiments. I think it's safe to say that we are all beleaguered with the condition that we face, but we do face it. And I want to give congratulations to you and to Brent for doing just a fantastic job of articulating the situation and articulating what needs to be done. I want to give some credit to the city manager for his efforts in this as well. From the city standpoint of view, I think we've done all that we can do. The one thing that's kind of interesting is that our anonymous donor continues to come up with more green light bulbs, which I know is a little trivial to some people, but it's not trivial to others. It's amazing every night when we do our little ceremony at City Hall, how many people come by and want to pick up light bulbs. And if that helps people get through this time, come get all the light bulbs you want. Every night at before dusk, in front of City Hall, you'll find somebody to give you light bulbs. Other than that, to echo your words, Mike, everybody keep doing what they're doing. Next week, we all start wearing masks in the presence of others, and that'll be enforced. So did I lose you, Mike?
We
Yeah, we lost you there for a minute.
Yeah, just for a second. You back on now, aren't you?
Yeah. I am, yes.
Okay, okay. Judge, how about you? Some comments?
Well, I, like the mayor, want to personally tip my hat and salute both you, Mike Wilder, and Brent Blevins and Public Health. Your entire staff have contributed immensely to people's understanding and their participation successfully in this endeavor that we're all in together. And I'll be honest to everybody that's listening, if there's anybody besides the four of us on this, hey, there couldn't be a better team out there anywhere, in my personal opinion, to reach out and provide the public with access to some of the best information that is in addition to what they're getting elsewhere. It's in addition to, because we personalize it, we localize it, and that's the difference between what we've been trying to do for the last 4+ weeks. And I'm hopeful that as the need arises in the future, the four of us, the mayor, myself, public health, and emergency management will come together, and I know we will, because that's who we are, and make those things work for the best of Boyle County's interest and everybody across the board. So I'm extremely excited. As the future goes, we're still discussing reopening protocols, but here at the courthouse, when we reopen, along with the administrative office of the courts, circuit court, district court, family court, in the building that we share functionalities with, I know for a fact that in order to be in unison with many other counties across this state, at the discretion of the better part of safety, our employees right now, it hadn't been publicized, but our employees at the courthouse and with the county government and those that are working in AOC will have a mask on if they are in the proximity of other staff and or the public. We will ask the public entering the building to be masked likewise, okay? I am not, nor do I believe in all good faith and confidence that a violation of that request will end up in a very bad place. Although we can work things out, if you don't have a mask when you get here, we'll try to make provisions where we can put one on you, get one on you. But I want to say that I'm hopeful that the masks are not a new long-term normal. When we talk about the new normal, I hear that term all the time. Brent, I don't want to go off script here with you in any way, shape, or form. But I don't want this to be the new normal for me. And I'm willing to be very compliant until we have a better understanding of the vulnerabilities of this virus and it is mitigated as much as possible. So I just ask for your continued patience. I feel like every day it's getting closer to where we can move to the next step. I may disagree with the protocols that have come forward from Frankfurt, and I've asked for innovative ideas to help maybe speed that up. I've not received any, but I just want the people out there to know how much I appreciate your participation, and it has made Boyle County, for our population, a very significant success story in our dealing with this virus. And I want to thank everybody on this conference call, video conference call, and all the public out there too. So stay safe, and we're gonna get through this together. Thank you.
Thank you, Judge. The one thing that a lot of folks don't realize and comprehend is what we're going through is something that is just totally new. You can look at all the plans and all the things that emergency management people do, that the Department of Public Health does, but this it's just something that's so new. It's so vast. I mean, it's just it's been a tremendous learning experience for myself, I know, and I think Brent will agree with it as well. It's just been a great learning experience. I hope we don't have to get through it again, but I think the fact that we've learned tremendous lessons in this is great, and I just couldn't be more pleased with the response that we've got for that. Do you agree with that, Brent?
Oh, absolutely, I do. I think, when you look at what's happened here in Boyle County and even surrounding counties, one thing that's been to our advantage right up front is we don't have that high density like a Lexington, a Louisville, those kind of places. So we had that going for us immediately. And because of that, I think that's helped our numbers in addition to everything that the community has done. It is very, I am very grateful for the people in the community that have stepped up and just said, yeah, we might not agree, but we'll do what's needed right now. And to help us all as a community get through this. And that's helped all of us in our jobs as we try to get through this the best we can. So, but I also want to echo what all you guys have said, man. I've really enjoyed being on these, talking with all of us, getting the information out. I also learned, well, I'll add this one in too. Normally I post every day what our number of cases are and just a little bit of information. And I've learned that's even getting a little stale for the public. So I put that out yesterday that I'm going to post every Tuesday and Friday, unless we have some big surge or something, then I'll go back. But I'm going to do Tuesdays and Fridays for a while and just try to see if I can't make my message a little more relevant than the everyday I've been doing. And I'll continue to post cases then too. But the same kind of philosophy, I think people get used to seeing it, and it's okay to not see it a couple days and maybe make that a little fresher for them when I post that on Facebook every day. So you may keep going, Mike. I've got a couple other things here.
Yeah, go ahead. Yeah, that'd be fine.
All right. And you'll see this at 4. As of right now that I know of, we're at 19 cases still, but we are down to where 2 of those are still active, meaning we're actually following them still. They haven't finished their 14 days. So we've got 2 active, and both of them are doing fine right now. So we're real pleased with that, of how that's working. I will say this also I've had a lot of questions about events, and I really appreciate it. I can't even count the number of businesses that have talked to me in the last 2 months, but particularly in the last week about reopening. And I really appreciate what they're doing, the steps they're taking to do it the way that we need that done. But I will say this just to the general public. If you are planning an event that normally you do, I don't know, fireworks, or you get your family together and you get a big group together or anything, push that back for at least a month, if not a couple of months, and go ahead and just don't be planning that for the end of May. Try not to plan that in June if you can, and start getting into that July, August time period. I think then we'll have a much better shot of being able to do those type of events. It just will help. It gives us a little more time in between those happening. The mask, and Judge, I like what you said about that, because that's the same guidance we give to a lot of people. And we talked about this last time. If you're in your yard, you're outside running, you're walking, you're not around people, you're fine. But, as we get back in our workplaces, there's going to be times when we need to wear a mask. There's other times we don't. When we're sitting in our office, we're the only ones in there. There's nobody around us, then we're fine. But if everybody, and so far, I think everybody's been really good about this, just be sensible about it. When you're within 6 feet of somebody, throw a mask on. If they're not immediate family or somebody that you're around every day, that'll help. Now, the thing with the mask, and you all have heard me say this, so you're probably tired of me saying it, but the only real big issue I have with the mask is it gives some people a false sense of security that once you've got on the mask, you're totally good. The deal is the 6-foot distancing is the real deal on this, and the mask helps back that up in those needed situations. So just continue to be 6 foot apart. I know our stores have done a good job of that. A lot of our stores that are reopening now are going to need the public's help on that, because it's one thing for them to put lines on the floor and say only so many people in the building, but it is difficult for somebody working there to tell everybody coming in, if they're not following social distancing, hey, this is what you've got to do. So as the public, let's make that as easy as we can on these stores as they reopen, because it's hard enough for them right now trying to keep up with PPE, sanitizing, all the things they have to do. That's a job in itself right there. So let's make that as easy as we can on them. Continuing, obviously, the testing, if that's something you're looking for, and we've said this all along, Ephraim is doing that, as well as, Dr. Ravi, and I think Dr. Ellis and Dr. Hempel. So we've had testing for a long time. So if that's something you need, something you're looking at, you can certainly reach out to any of them, and they'll be able to work with you on that. I'm still getting quite a few inquiries about churches. As far as I know, that's still May 20th. And I've had a lot of churches call me and ask guidance on that, and a lot of them have some really cool ideas. So just keep that in mind. That's not till May 20th. I know it seemed like a long time, but we're pretty close to that, of people being able to go back to their churches if they want. Now, there's going to be some things those churches have to do before people can come and sit in that auditorium, and as far as numbers of people that can sit there. But we're getting close, so hang in there. We'll get there. And then that Healthy at Work website, man, that's a great place to go if you want to know what industry or what business is getting ready to open or when they can. That gives you a lot of information right there. Okay, guys, I think that's most of what I had on the top of my head. Any questions?
Brent, I think we're good.
All right.
I don't believe I have any.
All right.
Mayor, how about you? You good?
No, I want to particularly take a minute and thank the big box stores and even some of the smaller stores. I know it's been difficult, but they've done their job, and I very much appreciate that. And I know it's not been easy. I know it's been inconvenient.
Well, the one thing I'd like to add to that.
Our numbers prove that. So they've done the job. It's a team effort, gentlemen, and you all know that as well as I do. You can't. We kind of have to look towards Brent for leadership. But I will say this about: I had the opportunity to be at the state EOC one day this week for a meeting, and first time I'd been over there since all of this had happened and the EOC was activated, and had the opportunity to go into the trailers that the Department of Public Health occupy now since they're out of the EOC. And they really shouted some praises for Mr. Brent Blevins. They were very pleased with the people up there. They all said the same thing. Boyle County is one place they did not have to be concerned about as far as doing the right thing. And I said, well, you don't know the same guy. No, I didn't say that. But that's just a shout out to Brent, and these were the people that are in charge. I mean, we had a deputy commissioner there, and the people that run the show, and they were aware of Boyle County. So that's for Brent. Yes,
I appreciate that. It truly is a team, and I've had a tremendous amount of help from you guys and a bunch of others, and it makes a difference every day.
The one thing I'd like
ladies
to
and
say,
gentlemen, I guess if we don't have anything else to pursue, we're gonna check out of here, and we do have the opportunity to get back on at any time we feel like we need to. So, but other than that, you've seen the last of these four gentlemen for a while, hopefully. thank you all very much for your attendance. Thank you guys too.
Thank you. Have a good day.
And Bill Nichols as well. Yes.
Absolutely.
Thanks, Bill.
Thanks again.